So we have Kim Moore, public health nurse with the Los Angeles County Vaccine Preventable Disease Control Program through the County Department of Public Health. So I'm going to go ahead and mute everybody but her so that we don't have any distractions. If you have questions at the end, please do use the chat function, and I'm going to hand it over to Kim.
All right. Well, good morning, everyone. Thank you, Malika, for organizing this webinar, and thank you for the opportunity to present information on vaccines and vaccine safety. I'm very delighted to share this information. Please type your questions in this comment box if you have any questions, and we'll allow enough time at the end of the presentation to address the questions. Any questions that may not get addressed today, we'll definitely send those answers to you in the email. Also, you'll see as we go along, just a second here. Okay, do this. Okay, you'll see continuing education credits and certificate of participation. Please complete the post-test and evaluation at this link by November 20th, 2018. If you wish to receive a 1.5 continuing education credit certificate or certificate of participation or a copy of this presentation, you will receive your certificate and a copy of this presentation 1 to 2 weeks after the post-test and evaluation are complete. Disclosure. Anytime we give a speak or a presentation, we always disclose that we don't have any financial interest. I don't get any money from any pharmaceutical company to present this information. I do, however, get occasional money from this individual in the middle with this red arrow over his head, who is my husband. Okay, so learning objectives. By the end of this presentation, participants will know how to discuss the role of the public health nurse in the Los Angeles County Vaccine Preventable Disease Control Program, identify vaccines that are safe for pregnant women, discuss the benefits of Tdap for mother and infant, discuss vaccine safety, talk to parents, patients about vaccines, discuss the risk of delayed immunization schedules, and locate resources and tools to encourage vaccination. Okay, so just a poll, if you can type in here, no big deal. Vaccines are recommended during pregnancy. Is that a true or false? Uh-oh, Melanie it's going ahead. Oh, there we go, okay. I think maybe I have it. I don't think I have it. No responses here? You guys want to type any response? Well, if you answered true, you're absolutely correct. We do want to give vaccines during pregnant women. Okay, so we like to think of prevention as this scenario. When should the bike helmet go on when you ride a bike? Should it go on A, before you ride the bike, B, while you're on the bike, or C, after you have the accident? Any responses over here in this box? No? Well, hopefully you said A. You want to put that helmet on before you get on the bike. That's how we think of immunizations. We want to get immunized before we develop the disease. Okay, so the role, I'm sorry this is in the way here, but the role of the public health nurse, and this is our team over here, I'm going to just provide an overview of what we do. Keep in mind that all of our activities, some issues with this thing, sorry. Maybe I do. Melanie, 1 second, you guys. Let me take this off slideshow. I have a feeling it's on slideshow because my keyboard isn't working. Hold on a second. So we'll just end that in slideshow. From current, right? Yeah. See, I know. Yeah. Which one should I click? That one to go to the next. This one? Yeah. Just click there when I want to push it. Okay. All right. So we're going to provide a brief overview of what the public health nurse does in the Vaccine Preventable Disease Control Program. So all of our activities that we do as public health nurses are all related to the entire goal of the Vaccine Preventable Disease Program. And that goal is to decrease vaccine preventable diseases by increasing vaccination rates. Okay. I'm sorry, you guys. This advance is doing its own thing over here. Bear with me. All right, so we provide professional education and training on vaccination schedules, vaccination of special populations, adults, adolescents, healthcare workers, school recommendations, and we also have an Immunization Skills Institute training. This training is excellent for anyone in the business of giving vaccines. You learn how to administer, document, and store the vaccine. You want to think of a vaccine as a food. If it's not stored at the right temperature, it's useless. And we have had some situations in LA County where we've had to do some recalls because we found out the vaccine was useless or stored improperly. We also investigate cases reported to the Vaccine Preventable Disease Control Program. We monitor contacts for potential disease activity, and we provide prophylaxis to family if necessary. Currently, we're seeing outbreaks of mumps, and the new recommendation, if you have someone who has the mumps, their contacts, anyone in close contact with them, even if they've had 2 mumps, we recommend that they get a 3rd mumps dose, because the research is showing that the mumps, the protection tends to wane, and that 3rd one will help add some added protection. We investigate potential outbreaks in schools. We monitor contacts, students, staff for disease activity. We promote Tdap vaccination. We're always, not just LA County, not just California, but the whole US is always in a pertussis epidemic, also known as whooping cough. We provide quality assurance reviews on anyone giving out vaccine. Usually it's the providers that are in our Vaccine for Children program, the program that gives out free vaccine. And again, our goals are to ensure that the child adolescent standards related to immunizations are followed, as well as some immunization laws, that vaccine is stored correctly, and proper documentation. And we provide consultation to healthcare providers, hospitals, patients, the community, anyone interested in learning about vaccines. And we do have a hotline. You can call this number Monday through Friday from 8 to 4:45, and we will answer any immunization question you may have. And last but not least, we have a perinatal Hep B prevention unit. I coordinated this program for 8 years, and it's a very effective program. We case manage hepatitis B surface antigen positive pregnant women, including their household and sexual contacts and infants. We provide education to the mother just to ensure, we want to make sure that she knows what to do to prevent her baby from getting hepatitis B. Moms usually plan to deliver at one hospital, but as life has it, they may end up delivering somewhere. So we want that mom to be able to verbalize, I am hepatitis B positive. My baby needs to get the hepatitis B vaccine and hepatitis B immune globulin within 12 hours. We notify the hospitals. If we know where the mom plans to deliver, we'll notify the hospitals and make sure they're aware that this mom is coming. And again, make sure the baby gets the Hep B vaccine and HBIG within 12 hours of birth. And we also track infants to ensure vaccination series and immunity testing is completed. This is hepatitis B vaccine is very effective, but it's not going to work on everyone, which is unfortunate. Sometimes you have moms that have been hepatitis B positive since they were little girls, and they're more virulent. So the baby may get infected in utero. And this is a good example of the importance of following standards. And we'll get into that a little bit more detail later on. Standards, you should look at the standards as laws, because if you should get in trouble legally, this is what they're going to look at in court. So it's always important to follow the standard. You don't want the mom to say, because your hospital didn't give me my baby the Hep B vaccine or HBIG, now my baby has hepatitis, and I'm going to sue you guys. All right, so let's move on. So recommended vaccination during pregnancy for pregnant women. We're going to discuss the benefits of we're going to discuss the benefits of influenza vaccine. I wonder if I could move this down some. Where should I move it? Just minimize it. Bear with me, you guys. I'm going to try to get this out the way.
Kim, actually the dashboard isn't visible to us. It's
invisible to you? Oh, good. Okay, thank you. All right, thank you, Malika. But then they may have some questions. Well, we'll take your questions at the end, so we'll check out the questions. I'm just going to bring it back. I know. See, it's on our screen. Can you see it, Malika? The dashboard? Oh.
No, we can't see your dashboard.
We can't see it? Okay, because I thought it was blocking the slide. Well, I'm glad it's not blocking the slide. All right, so benefits of vaccinating mothers during pregnancy. And this applies to both influenza as well as the Tdap vaccine. Both vaccines enhance immunity for both mother and baby. Maternal antibodies protect the mother from infection. They also cross the placenta and protect newborns and young infants. Transplacental antibodies provide protection during a vulnerable period before a baby's immune system matures and can adequately respond to a vaccine. Breast milk antibodies also provide some form of protection. This thing has a mind of its own. I'm sorry about that. It's jumping ahead here. All right. Okay. So influenza. Influenza is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and lungs. Can cause mild to severe illness and death. Flu season typically starts in October and can last as late as May. A yearly flu vaccine is the most effective way to prevent the flu. Influenza and pregnancy. Pregnant women are at an increased risk of serious illness from the flu due to changes in their immune system, their hearts and lungs, their bodies are accumulating more fluid to get ready for the baby. Complications from the flu during pregnancy may include premature labor, small for gestational age, hospitalization, and death. Oh, and I want to mention, you guys, there are links at the bottom of all of these slides where you can click and get additional information if necessary. Okay, so here's a little bit of history on the influenza vaccine, influenza and pregnancy. 100 years ago, the 1918 influenza pandemic devastated entire communities and took an estimated 675,000 American lives. It was the most severe pandemic in recent history, sweeping the world quickly and killing more than 50 million people. In 1918, approximately 50 to 61% died from pneumonia, and this is pregnant women during the latter part of pregnancy. In 1957, 50% of women of childbearing age who died of influenza were pregnant. 10% of all influenza deaths that season were in pregnant women, most in the later half of pregnancy. Since 2005 through the H5N1, which is the avian influenza, the bird flu, there were 6 affected pregnant women, 4 died, 2 survivors had spontaneous abortions. Post-mortem studies suggest possible mother-to-fetus transmission via placenta. Interpandemic case reports of complications since 1950s, mostly healthy women in later stages of pregnancy. And then we have the infamous H1N1. Okay, 2009, influenza H1N1, also known as the swine flu. From April 2009 to 2010, these are some stats. 26.9 was the mean age in years. 18 to 43 was the age range in years. There were 347 severely ill pregnant women with the H1N1 flu. 272 were admitted to the ICU. 49, which represents 64%, had preterm babies. 28, which is 36%, had term babies, 37 weeks and older. There were 75 deaths. 45, which represents almost 60% deaths occurred during the third trimester. This is why, well, we'll get into it. 40 had, which is 62%, had underlying illnesses such as asthma, obesity, and diabetes. So the coordinated efforts of public health and healthcare providers and community organizations can minimize the effects of future influenza pandemics by increasing the rate of influenza vaccine administration during pregnancy. Anytime you have a high rate of vaccination, you should have a low rate of vaccine preventable diseases, and that is our goal. So here are some influenza cases in LA County. That last flu season was very bad. There were a total of 107,199 cases, positive flu tests. The total deaths were 278. And I just highlighted the most significant stats, the categories that had the highest stats. It was the 65 and older that had the most deaths. There were 219 deaths, which represented 79% of all the deaths. The female was affected 54 by, there were 54% of were females. That's 151. Wait a minute, 54. And the race was white non-Hispanic, representing 42% of the race. Although the 65 and older had the most deaths this year, really anyone 50 and older is at increased risk for complications due to the influenza, and we need to keep that in mind. So influenza vaccination recommendations for pregnant women. Influenza vaccination is recommended for all pregnant women, regardless of the trimester. Millions of pregnant women have received the flu vaccine over the years. Effective July 1st, 2006, per California Law, Assembly Bill 2943, and you can see that section 124172, pregnant women and children under 3 years of age should receive preservative-free, inactivated influenza vaccine. So the way you can tell it's preservative-free, it should be in a syringe already drawn up. The preservative is put in the multi-dose vaccines because anytime you have to go into a vial multiple times, there's always a risk of injecting bacteria in that vial. So if there was no vaccine, that vial would get contaminated. Pregnant women should also never, ever, ever receive the nasal spray. This is a live vaccine. They should not receive any live vaccines. Live vaccines are contraindicated. I'll get back to that, are contraindicated because the thought is if mom gets injected with a live vaccine, it's possible she could transfer that vaccine preventable disease such as influenza to her infant. Pregnant mom can receive trivalent or quadrivalent vaccine, and the difference between the two, tri covers 4 different flu viruses, quadrivalent covers 4 different flu viruses. It's okay to get while breastfeeding, protects mother and her baby up to 6 months old from the flu. Babies 6 months and younger are too young to receive the flu. This is why cocooning is very important. Cocooning is everyone surrounding the baby, visiting the baby, taking care of the baby should get the influenza vaccine. So trimerisol, just in case you're wondering, trimerisol is the preservative that's in the multi-dose vials. It's needed again to produce enough vaccine for the entire country. And it decreases the risk of introducing microbes into the vial. And children can safely receive flu vaccine that contains trimerisol. Flu vaccine, again, in a single vial that does not contain trimerisol. Okay, so here's a study, a year-round influenza immunization during pregnancy in Nepal. Phase 4 randomized placebo-controlled trial that was published in 2018. There are several, and when you click on these links, there are tons of research on both the Tdap and influenza. I always just try to get the most current one. There were 3,693 pregnant women enrolled in 2 cohorts. They were either in the placebo or the vaccine group. The placebo, meaning they didn't get the vaccine, they may have just got some normal saline. These women, there were 3,646 live-born infants in 2 cohorts with their mom, either the placebo or the vaccine. And the results of this study, the women that received the influenza vaccine during pregnancy, it reduced maternal febrile influenza-like illnesses by 19%. also reduce influenza infections in infants aged 0 to 6 months by 30% and reduce the rates of low birth weight by 15%. So did anyone get a chance to look at their schedules that I sent over, or had Malika emailed you guys? I emailed recommended.
They're all materials tab. So if on your dashboard, there's a materials tab. So the schedules are right there if you want to take a look.
All right. Yeah. Well, no problem. We're going to cover it all right now. This is the recommended immunization schedule for adults age 19 or older in the United States for 2018. Anytime you talk about immunization, you always want to make sure you're looking at the most current immunization schedule. The schedule comes out every year in February. It's based on, it's evidence-based. It's based, the amount, the number of vaccines, as well as the spacing, it's all based on evidence to provide people the best protection from these vaccine-preventable diseases. So I'm just going to go over this real quick because honestly, I probably did not look at the first page of the schedule until I started working in the immunization program about 10 or 11 years ago. So it's some good information in here to help increase vaccination rates. Well, first of all, it's approved by these organizations. It's approved by the American College of Physicians, the American Academy of Family Physicians, the American College of OB/GYNs, and the American College of Nurse Midwives. The figures, anytime you look at this schedule, you always want to look at the footnotes. And I have to warn you, even though this is the most current schedule, we received multiple updates throughout the year. So there have been some updates to this schedule. So it's always important to look at footnotes. Increased interval between, when indicated, administer recommended vaccines to adults whose vaccination history is incomplete or unknown. Increased interval between doses of a multi-dose vaccine series does not diminish vaccine effectiveness. So you don't have to start a series over. For example, if someone comes in to get a Hep B vaccine, there's 3 vaccines in that series. If we see them today and then they come back for the second one in 2 or 3 years, we don't start over. We just start with that second vaccine and continue to the third. Also, it's important to take advantage of any office visit. Healthcare providers tend to wait for that big annual visit or well child exam to immunize. Don't wait. Anytime a patient, encourage your patients to, anytime they go into the office to see their healthcare provider, ask about immunizations if there are no contraindications. And this is a special population, the pregnant woman, who we are going to focus on. And it's recommended for the Tdap and influenza is recommended for all pregnant women. And then up here, you have some additional resources and links that you can check out. And I can't really see where I'm clicking because that thing is in my way here. Let's see. Okay, so this red highlighted area, this is where you can find the immunization schedule for the child and adolescent 18 years and younger. And okay, I think we're ready to move on. Okay. Oh, VAERS. We're going to discuss VAERS. We're going to discuss that a lot when we get to our vaccine safety section. Vaccine Adverse Event Reporting System. That is a system you can use, healthcare providers, patients, parents, if they believe a vaccine caused an adverse event. You can call the 800 number or you can file a report online with the CDC. All right, so we're going to focus, this is the part, figure 2, is the immunization schedule for medical conditions. And we're going to focus on the pregnant woman, that red highlighted column over here. We're going to focus on this. So when you see, and this is our key down here, and again, we're on the 19-year-old and older with medical conditions, current year is 2018. And this is our key down here. So anywhere you see this yellow, it's pretty safe to give during pregnancy. If you see purple, it's okay to give during pregnancy, but the healthcare provider needs to weigh the risk and benefits of the pregnant mom. The healthcare provider and the patient need to weigh the risk and benefits of the pregnant mom getting these vaccines while pregnant. If mom is exposed to hepatitis A and she has not had any hepatitis A vaccine, it may be worth it. We always think it's worth getting the vaccine versus getting the disease. Anytime you see red, just like the stop sign, stoplight, that means no, don't give, contraindicated, and those are live vaccines, measles, mumps, rubella, varicella, and zoster vaccine. So these are the recommended. Influenza and Tdap are recommended vaccines. And you can see that footnote number 1 and footnote number 2. We'll take a quick look at those footnotes. So this is footnote number 1 for influenza, right here. And it's pregnant women. A pregnant woman should get an influenza vaccine during all pregnancy, during every, during influenza season if she's pregnant, excuse me. Also, this is the Tdap, footnote number 2. All pregnant women should get a Tdap during each pregnancy, preferably between the 7 and 36 weeks. And I know that sounds excessive, but we'll talk a little bit more about that why later. This is where our recommendations come from. The MMWR, Morbidity and Mortality Weekly Report. And the influenza vaccine recommendations came out August 24, 2018. And if you were to click on this link, it would take you to the CDC page. You would look for current influenza vaccine recommendations. And if you want to read the entire report, you could click on this link, or this red arrow if you just want the quick summary, 4-page summary right here. All right, so I clicked on that link, and this is the recommendation. Groups recommended for vaccination, influenza. And of course, here we go. We got the pregnant woman. And these are the other recommendations. Really, anyone 6 months and older should get a flu vaccine during flu season. Pregnant women should get one if they're pregnant during flu season. Okay, so recommended vaccines in pregnancy, the benefits of Tdap vaccination. Okay, whooping cough or pertussis. Pertussis is also known as whooping cough. Sounds like someone is gasping for air after a fit of coughing. And there's a link on YouTube if you've never heard what whooping cough sounds like. It sounds like, let's see if I can do it, almost like Strider. It's a real distinct cough. So if you hear a child doing that, definitely get it checked out. Now, adult may just have a cough. Adult may not have that whooping cough, that sound. Coughing fits can last for up to 10 weeks or more, also known as the 100-day cough. It's highly contagious, and it's caused by Bordetella pertussis. It's an insidious onset, very sneaky, just like you may think you have a minor upper respiratory infection with nonspecific cough. It can be life-threatening in babies less than 1 year. Although babies less than 1 year are at risk, it's the infants 3 months and older, 4 months and older that are at risk for death. We just had a death in pertussis, one pertussis death in San Bernardino. Child was 4 months, they just said 4 months and under, not exactly sure of the exact age. In 2018, there were 2,452 cases in California, and this was as of 10/7/18. And you got to keep in mind when you're reporting to these results are provisional because reports are still coming in the public health. There were 243 cases of pertussis in LA County. 90 cases were less than 4 months of age, and many cases are undiagnosed. A lot of people don't go get swabbed and check to see if they have pertussis. Vaccination is always the best prevention. Pertussis, whooping cough, the clinical complications, infants and young children, apnea, they stop breathing, pneumonia, seizures, death, encephalopathy as a result of hypoxia from coughing, possibly due to from the toxins. Adolescents and adults can lose weight, urinary incontinence from coughing, syncope, dizziness, and rib fractures from severe coughing. Why is Tdap recommended during every pregnancy? I always wondered this because when this recommendation came out, my daughter was pregnant and I thought it was a little excessive. However, as I read the research, I understand why. All the ACIP, which is the Advisory Committee on Immunization Practices, they recommend all pregnant women receive Tdap from 27 to 36 weeks gestation. After receiving the Tdap, the maternal antibodies decrease quickly. The third trimester provides the highest concentration of maternal antibodies to transfer to the baby. A minimum of 2 weeks is required to mount a maximal immune response protection to the vaccine antigens after receipt of Tdap. And keep in mind, most vaccines, it takes at least 2 weeks, not just the Tdap, to provide protection. Pregnant women who received Tdap during the first or second trimester had low levels of antibodies at term. So this is why they want pregnant women to get it during that last term so that she can protect her unborn baby who was too young to get the Tdap, and that Tdap will provide some protection to her baby after her baby is born. So this is the recommended immunization schedule for the child and adolescent 18 years and younger, very similar to the adult, so I'm not going to go over it. Only difference, this one is approved by the American Academy of Pediatrics, and I think this one is also approved the adults, the American Academy of Family Physicians. So pretty much the same information in there. So we'll just go right over by that. And this is a little different from the adults. This is the immunization schedule for medical conditions, and we're going to focus on pregnancy again. Only difference with the child, they also have hepatitis B in yellow. And it's okay to get during pregnancy. This is an adolescent because they may need their hepatitis B. And again, it's always up to the healthcare provider and the patient to weigh the risk and benefits of the vaccine versus the risk of getting the disease. And pretty much the same influenza as adults, the recommendation, and the recommendation for Tdap is the same. And this is where you would find, click on that link, this is where you would find the current Tdap recommendations. Again, you can read the full report there if you like. So benefits of, let's see, breastfeeding and vaccination. Good news. Last time, a few years ago, when I looked at these resources on breastfeeding and vaccinations, it was a little different. So it's very important to, make sure you're providing the most current information. If I had used a presentation I used from like 2 or 3 years ago, I would have been giving you the wrong information. So now breastfeeding and vaccinations, the only contraindicated vaccinations are the smallpox and yellow fever. And the other ones are all safe to use in breastfeeding. So which vaccines are contraindicated in pregnant women? Can you guys answer that? Let's see, are you guys awake? Let's see, where's the poll? You guys respond for me.
There's no poll function. They're just answering in the chat box.
Pat, can you see right in here? Just type it in there. Which vaccines are contraindicated in pregnant women? Would you say the nasal flu vaccine, the measles, mumps, rubella, the varicella, or all of the above? You can just type in A, B, C, or D.
So we're getting some answers in the chat box. Do you see those?
I cannot see those. It's blank. Blank on my end. Are there any questions in that chat box?
There's one question about Tdap. It's every pregnancy for the woman, but how about the partner or other caregivers? Do they need to get it for each pregnancy or child?
No, just the pregnant woman. Yeah, and usually they only need to get a Tdap once in their lifetime. And then in 10 years, they can get a TD if necessary for tetanus. But no, it's the pregnant woman who has to get it every pregnancy to build antibodies.
And we're getting some answers to your question. We have several D.
What they are? I can't see them.
Yeah.
What letter there, Malika?
You're looking in the chat box?
I'm looking in the chat box. My chat box is blank.
I don't know what's going on then.
Oh wait, no, I'm sorry. Here, I see it. Sorry, team. A. Oh, I see a lot of A's. Okay. A, D. I see a lot of D's. Very good. Okay. Well, that's pretty good. If you answered D, all of the above, you are correct. Remember, these are all live vaccines: measles, mumps, rubella, varicella. They're in red on that immunization schedule. We don't give live vaccines during pregnancy because it may transfer mumps, measles, rubella, or varicella, or influenza to the baby, to the fetus. So we never give live vaccines during pregnancy. Thank you, guys. All right, so let's move on. So now let's discuss vaccine safety. Okay, so vaccine safety. Keep in mind that a vaccine goes through the same rigorous process as a medication before it is approved. Currently, the United States has the safest, most effective supply in its history. Prior to licensing and public use of any vaccine, the pharmaceutical company must submit an investigational new drug application to the Food and Drug Administration to begin clinical trials with a vaccine. Extensive lab testing and clinical trials are done that can take several years. The FDA plays a major role in this process. They have highly trained scientists and doctors that evaluate results of studies on safety and effectiveness. They ensure the availability of U.S. approved vaccines. There is availability of U.S. approved vaccines, and they conduct inspections to ensure vaccine manufacturers are following strict guidelines. Second here. Thing is going crazy here. Bear with me. One second, you guys. Yeah, maybe another mouse. Oh, here we go.
Kim, when you use the arrows on your keyboard, does that work?
No. Oh, wait, let's see. Yeah, maybe that'll do better. But see, it's jumping ahead without me touching anything. We don't know why it's doing that, and I apologize. Here we go. Okay, so vaccine development and approval. And this is a process, again, that can take years to get through. This is a diagram of 3 phases of a clinical trial to approve a vaccine. Reminder, vaccine clinical development follows the same rigorous pathway as drugs and other biologicals. Pharmaceutical companies wishing to begin clinical trials with a vaccine must submit an investigational new drug application to the FDA. The FDA sets the rules for 3 phases of clinical trials to ensure the safety of volunteers. The consent for humans to participate in any research requires approval by an institutional review board. The institutional review board's main function is to review research to assure the protection of rights and welfare of human subjects. Researchers test vaccines with adults before testing children. There are 1 to 4 phases of a clinical trial. In phase 1 to 3, in addition to researchers looking at vaccine safety, effectiveness, and side effects, they're also looking at, in phase 1, how is the size of the dose related to side effects? Is the initial human study phase that consists, this is an initial human study phase that consists of 20 to 100 healthy volunteers. Phase 2 consists of several hundred volunteers. Researchers are also looking at how are volunteers, their immune systems responding to the vaccine. Phase 3, this is the most informative phase because this phase enrolls hundreds or thousands of individuals and provides the critical documentation of effectiveness and important additional safety data required for licensing. Researchers are also looking at how do people who get the vaccine and people who do not get the vaccine compare. Phase 4, although this phase is not on the slide, researchers cannot study all potential adverse events until a vaccine is given to the general population. Thus, many vaccines undergo phase 4 formal studies on a vaccine once it is on the market. The FDA may request additional information on studies or may halt ongoing clinical trials at any stage if data raise significant concerns about safety or effectiveness. The FDA only licenses a vaccine if it's safe and effective and the benefits outweigh the risk. Patients are encouraged to discuss the risk and benefits of a vaccine with their healthcare provider. Vaccines are made in batches called lots. Manufacturers must test all lots to ensure that they are safe, pure, and potent. The FDA will not release the lots until they review the lot safety and quality. As mentioned earlier, the FDA inspects manufacturing facilities regularly to ensure safety and quality. All right, so this is the timing of vaccine development and approval. There's a preclinical phase. This can take several years. Researchers must find out whether the vaccine has the potential to cause serious harm, toxicity before testing the vaccine in humans. Phase 1 can take months, phase 2, months to years, phase 3, years to decades, and phase 4 is ongoing. So how is a vaccine added to the U.S. recommended immunization schedule? The ACIP that we mentioned earlier, the ACIP is, it consists of, the ACIP is the Advisory Committee on Immunization Practices, and it consists of 15 clinical medicine and public health experts who are not government employees who provide guidance on the use of vaccines and other biological products to the Department of Health and Human Services, the CDC, and the U.S. Public Health Service. This is where our department, where we get all of our recommendations on immunization. So the ACIP, they review all available data from the clinical trials and other studies to develop recommendations for vaccine use. They continue to monitor vaccine safety and effectiveness data and may change or update recommendations based on that data. As I stated earlier, we're constantly, daily getting updates on recommendations. The director of the CDC must review and approve the ACIP recommendations before they are official and then published. These recommendations then become part of the United States official immunization schedule. How a vaccine safety continues to be monitored. Even after the public begins to use the vaccine, the FDA and CDC continues to monitor vaccine safety by collecting reports and analyzing adverse reactions and side effects. The FDA and the CDC use these three systems to monitor vaccine safety. The first one we mentioned earlier, which is the Vaccine Adverse Event Reporting System, theirs. Again, anyone, including parents, patients, healthcare professionals, can submit a report either online or through the 800 number. There's the Vaccine Safety Data Link and Post-Licensure Rapid Immunization Safety Monitoring. These are two networks of healthcare organizations across the U.S. Scientists use these two systems to actively analyze healthcare information for 214 million people in the United States. Then, last but not least, there's the Clinical Immunization Safety Assessment Project. This is a collaboration between the CDC and 7 medical research centers. Vaccine experts assist U.S. healthcare providers with complex vaccine safety questions about their parents. And I'm pretty sure with our hotline, sometimes we get some challenging questions. I've called through the CDC, I've talked to the Clinical Immunization Safety Assessment Project. They also conduct clinical research studies to better understand vaccine safety and identify strategies to prevent adverse events following immunizations. If scientists detect a new serious side effect, a vaccine recommendation may change. So also manufacturer pregnancy registries. Both manufacturers of Tdap vaccine created pregnancy registries to collect information from pregnant women who got Tdap vaccine. The manufacturers have not reported any safety signals to the FDA, and here you can call their number, GlaxoSmithKline for Boostric and Sanofi Pasteur for Adacel. Their 800 numbers are there, and also the links for more information. And these are just some studies that I pulled up, summary of vaccine safety studies of Tdap in pregnant women and their infants. And pretty much just to summarize, there was no adverse events identified. And you can see the years and the information. And also, again, the link is there if you want to look at these studies in detail. Vaccine safety resources, again, we just talked about those, but there are the links to these resources. And patient care before administering vaccine. Even if you're not in the business of giving vaccines as a patient, or if you're consulting with the patient on vaccines, it's good to know this information. Healthcare providers should always obtain a complete immunization history at every visit, except only written dated records, except for influenza and pneumococcal self-report. Use recommended schedule to determine vaccines needed based on age, medical condition, and risk factors. Always screen for contraindications. Some contraindications, a person may look like they don't have any contraindications, but a patient may be pregnant, have some other health issues. discuss vaccine benefits and risk and vaccine preventable disease risk using the vaccine information statements and other reliable sources. Most important information, and I mentioned this to Malika when we were setting up this webinar, always best thing your patients can do is look at reputable information. I know that website, the internet is full of information, and some good information and some not so good information. Beware of, some of the .coms are okay, but preferably when you're talking about immunization, something with a .org, .edu, .gov, something with some evidence-based research behind it. Provide aftercare instructions. Again, .com, sometimes it's .commercial. They may be trying to sell you something, and there may not be any research to support what they're telling you. And always provide aftercare instructions, what to do in the event of an adverse event. So this is the screening checklist for contraindications for vaccines for children. And you go down that list, ask those questions, and on the right-hand side of the screen, these are why we're asking those questions, okay? And again, if a patient may be may have HIV, may be immunosuppressed, you have to beware. And that first, that schedule we looked at with the pregnancy column, they have those health issues on there and give guidance on how and when and if they should be immunized. And this is the same for the adult, screening for contraindications, and again, the reasons why we're asking these questions. And the rights of medication, it used to be 5, now we're up to 7. Anytime a provider gives a vaccine, always make sure it's the right patient, right vaccine, the right diluent. When applicable, that's what you mix the vaccine with. And it's not really funny, but it's kind of funny because we get alerts on vaccine errors, and some providers are giving the diluent. They're not even giving the vaccine. So if we're giving the vaccine, we want to make sure we're giving the vaccine and the diluent. Right time, including the correct age and interval, as well as before the product expiration date and time, the right dosage, right route, including the correct needle, gauge, length, technique, right site, and right documentation. All right, I want to see you guys answer this. I'm going to pull this up. True or false? By law, California Health and Safety Code 201056.8, a consent is required prior to vaccination. Let me see what you guys are going to say. Is that a T or F? Oh, I see it. Okay. True, good. I see some true. I don't know what that one means. Let's see. I see a true. True. All right. Well, that was kind of sneaky, you guys. The answer is, see here. False. I know that was tricky. However, it doesn't hurt, and a lot of organizations, hospitals, clinics do use a consent. It doesn't hurt, but really it's not required by law. What is required by law is a vaccine information statement. Anyone who gets immunized, doesn't matter how old you are, what kind of insurance you have, your healthcare provider by law is supposed to give you a vaccine information statement. This is required by the National Childhood Vaccine Injury Act of 1986, prior to vaccine administration. Not required by federal law to obtain a signature. Healthcare providers must document the vaccine information addition date in the patient's medical record, which is usually located in the bottom of the page. I'll show you that on the next slide. Make sure you are using the latest version and you never alter, and it can be found here. You can get many different languages and you can check the correct date because there's a lot of controversy surrounding immunization. You always want to make sure you're using the most current information. And the this, it just contains who should get vaccinated, very lay information, language, who should not get vaccinated, possible adverse events, what to do if you have an adverse event. Okay, so this is what the TDAP, this looks like, and here, this circled in red, that's the addition date that healthcare providers must document in the patient's chart. All right, so you guys, a lot of you said true, and we found out a lot of healthcare providers weren't aware that was required by law. Between 2009 and 2015, we did quality assurance reviews on really just about every delivery hospital in Los Angeles County. Anywhere a baby was born, we were there. And we were looking at medical records and looking to see how many patients received the vaccine information statement before they were vaccinated with the Hep B vaccine. So this blue column represents our first visit. As you can see, with the exception of this hospital, I forget which one it was, but the blue was in most cases lower than the orange. So the blue represents the first visit, and then the orange represents the second visit. A year later, we would come back to do follow-up, and we were happy to see that once hospitals realized the legalness about a vaccine information statement, they started giving out that vaccine information statement. So we were very happy to see the increases. Okay, so talking to parents about vaccines. The most important thing is to provide a strong vaccine recommendation. That's the most effective, and don't stutter. Ms. Moore, you're here for your prenatal visit, 27 weeks. It's time for you to get that influenza vaccine. We want to make sure you and your baby are protected. Normalize vaccination as part of the patient's prenatal care. Provide each patient with information and resources about maternal vaccines. Ensure your staff delivers consistent messages about the importance of maternal vaccinations. For example, I'm going to hear this. I also work in a clinical area. I wouldn't get that vaccine. You don't know what's in that stuff. It's that time of the year, and I know I'm going to hear it. Your staff has to be consistent. You got to be careful with your personal opinions. And we do know what's in the stuff. There's some links where you can look and see what's in the stuff. So you can't have the front desk person saying, I don't know what's in that stuff, I wouldn't get it. And then you're in the back trying to encourage patients to get the vaccine. So you want to make sure your staff is consistent and be very careful with negative inputs. It's okay to be honest, but you know, in the clinical setting, you want to be a little careful. Address physical and psychological barriers, such as clinical hours, or if they're afraid of needles. You got to find out why people don't want to get immunized. I received a call. We received a lot of good calls on our hotline. It was a father who was very upset that his child, he had an older child that was due for the Tdap, so probably in the 7th grade. And the father he didn't want to get it. And I think he was just mad because, you know, anytime you have someone telling you have to do something that bothers you. So, but then I said, you know, and it just so happened, I said, are there any new babies in your house? He said, yeah, I just had a baby. And once I told him, you know, how the baby is at risk for whooping cough, he softened up and he said, wow, you know, he's going to get immunized. So you got to, you know, find out where people are coming from and try to help them understand. And you guys are role models. And compare my colleague, my supervisor is here with me, Melanie. Melanie, how long have you been in this program? I'm sorry, I didn't introduce her in the beginning. Miss Melanie Barr, 13 years? Well, I've been in this program for 10 years, and I'm still, you know, when I first came, and this was right the next year, we were hit with, boom, H1N1, a new vaccine for the flu. And I was very nervous because it was new. So I didn't tell my coworkers, but what I was doing in my mind, I'm like, okay, I'm gonna wait I have 3 coworkers, I said, that I look up to, and were here before me. So I said, well, I'll let them get the vaccine, and if they don't grow a tail, then I'll get the vaccine. And they didn't grow a tail, so I said, okay, it's good to get the vaccine. So it's good to have a role model. Your patient, you are your role model for your patients. Here we go. Okay, so flu vaccination coverage among pregnant women in the United States, and this is from the 27 flu season, and coverage by healthcare provider, recommendation, and offer. And as you can see, if you offer it, 52% of women, they took the vaccine. And if you recommend it but don't offer it, you have 26% of the women who took the vaccine. And as you see, it's the lowest. If you don't recommend or offer it, very low women are going to get it. So it's important. They really look up to you. Offer it, mention it to them, tell them how important Tdap and influenza vaccine are during pregnancy. And here are some main reasons for why the women receive vaccination during pregnancy. Protect their baby was the #1 reason. To protect myself was the second. And here we go. Because my doctor or nurse or other medical profession recommended the flu vaccine. That was the third. So your You have a big influence over your clients. Sometimes it just gets stuck here, bear with me. Okay, so 6 steps to start the discussion. Take time to listen to your clients. Schedule a consultation appointment if necessary. Validate their concerns. Provide reassurance. Use a heart and head approach. You know, even though I work in the program, there are some vaccines that I'm a little nervous about. For example, the smallpox. I don't know why I got it as a child, but I'm being honest, I'm a little nervous. So find out and provide reassurance. Melanie, are you going to get the smallpox vaccine? She's shaking her head no. So I'm a little nervous. It's not recommended. Okay, use a heart and head approach. Share personal stories of patients. Now, if Melanie had said, yes, I'm going to get it, I probably would get it. Use a heart and head approach. Share personal stories of patients with preventable diseases or stories from your family. Provide positive personal stories. They can be very powerful motivators. Balance the risk and benefits, and that's always the patient and healthcare providers do, you know, their job. They need to discuss that. Help parents understand that not vaccinating is far riskier than vaccinating. Personalize vaccine preventable diseases as real threats, not things of the past. Some people, I've had healthcare providers tell me, oh, we don't have any of that in LA County. I'm like, you don't know public health. We have a lot of it in LA County. Be flexible. Discuss the risk of waiting if the parent requests a reduction or delay in the recommended schedule. Remember that parents have the right to opt out. Create a schedule that feels comfortable and allows the patient to get caught up over time. Now, parents opting out, if I could just share real quick, when we have outbreaks in schools, they don't find out that their child can be excluded from school for 21 days if there's an outbreak. And sometimes that encourages the parent to get the child vaccinated. When we say, oh, you know, your child can be excluded from school for 21 days, they're like, oh, whoa, where can I get him vaccinated? Direct them to reliable resources. We discussed that. Bewareof.com. It's not commercial. They're usually trying to sell you something. Connect persons with credible sources to lessen confusion about conflicting messages. Refer these to trusted sites. Again, Bewareof.com. We have the American Academy of Pediatrics. There's Trimerisol results from the FDA. Evaluating health information on the web, the National Network for Immunization, parents of kids with infectious disease, and do vaccines cause that? Vaccine, what are the benefits of vaccines? In addition, all vaccines, they prevent vaccine preventable diseases once killed or harmed many infants, children, and adults. Serious illnesses, they can prevent serious illnesses, suffering, pain, disability, and death associated with vaccine preventable diseases, such as what we discussed, influenza, whooping cough, influenza, and tetanus. We didn't really discuss tetanus a lot, but it's a minor threat. The disease prevention benefits of getting vaccines are much greater than the possible side effects for most. The only exception to this are cases in which a person has a serious chronic medical condition like cancer or disease that weakens the immune system or has a severe allergic reaction to a previous vaccine dose. And beware, that recommendation has changed because of the morbidity and mortality associated with influenza. They are recommending, if a person has had even an anaphylactic reaction that is caused, requires CPR, if staff is trained in the inpatient or outpatient setting, you can give that vaccine. Some hospitals are opting not to give. They don't want to go there. But again, because of the morbidity and mortality associated with the influenza, they're saying, hey, if you had an anaphylactic reaction to the influenza vaccine last time, you can still get it this time, provided staff will resuscitate you. So what are the side effects of vaccines? And you'll see that in the VIS statement. This is just a very general slide, but that's why you give a patient a VIS statement, so they can look at the possible side effects. Vaccines are like many medications and may cause some side effects. Most side effects are minor: soreness at the the injection site, fussiness, low-grade fever, typically last a couple of days and are treatable you can apply a cool, wet wash rag on the sore area to ease discomfort. Serious reactions are very rare. Severe allergic reactions can happen because you are putting a foreign substance in the body, and if they do, you contact your healthcare provider for any concerning reactions. So immunization misconceptions, there are a lot. There are no benefits for delaying vaccines. Some vaccine preventable diseases remain common in the U.S., as we just discussed, pertussis and influenza. Increased risk of developing vaccine preventable diseases during the time vaccines are delayed. So you increase the child or anyone's risk if you delay vaccination. Vaccinate preterm infants using the same schedule as term infants, with the exception of the hepatitis B vaccine. A lot of neonatologists, when we would do our quality assurance reviews, they wanted to wait to give the baby any hepatitis B, because if that baby developed a fever, they wanted to know why. But the research is showing they're delayed because of a lack of knowledge of healthcare providers. They're not aware that it is okay to give vaccines to preterm infants. But the Hep B, if they get that first one immediately, they will have to repeat it when they are of age, so that they can have maximal protection. Young children have the highest risk of having serious case of disease that could cause hospitalization or death. This is why you don't want to delay the vaccines. Hib or pneumococcus almost always occurs in the first 2 years of a baby life. Hepatitis B and whooping cough are more serious when babies get them at a younger age. The worst outcome of hepatitis B is cirrhosis of the liver and liver cancer. And babies are definitely at an increased risk for that if they get hepatitis B at birth. Help protect your child by vaccinating according to the CDC recommended immunization schedule. So if I may share this case study, I like to share it. It's an example of an outdated protocol and also delayed vaccines. You know, if you look to your left, this is the recommended immunization schedule for pneumococcal PCV7. And then if you look to the right, this is what Joe should have actually received. I mean, this is what he actually received. And if you look at Joe on the right, he was really delayed in getting the PCV7. And then on top of that, I'm just going to summarize what happened due to time. He shouldn't have even been getting the PCV7. At this time, they had phased that out and bought in the PCV13, the pneumococcal 13. So as a result of this, and this is why it's important when you consult with your clients on immunizations, you're using the most current information. This is what happened to Joe. He presented to the emergency room with symptoms of fever, cough, vomiting, and increasing lethargy. He was diagnosed with pneumococcal meningitis. He received treatment, but the infection progressed to encephalitis, subdural emphysema, obstructive hydrocephalus, septic shock, and respiratory failure. He developed disseminated intravascular coagulation with multiple organ failure. That's a very scary disease. You're clotting and bleeding at the same time, or problem, what we call DIC. You're clotting and bleeding at the same time. Very dangerous. He was hospitalized in the intensive care unit for 6 weeks. So the legal review, Joe's pneumococcal strand was a serotype 6A, which would have been covered by Prevnar 13. Chart review demonstrated Joe did not receive the Prevnar 13 vaccine, nor did his older twin siblings, who were promptly vaccinated with Prevnar 13. Joe was left with permanent seizure disorder, vision impairment, bilateral profound hearing loss, and left paralysis. The practice was sued for outdated systems and no process in place to update immunization policies. So if you're in the business of working with immunizations, you have to have a coordinator, someone who's getting those updates and staying up to date on the recommendations. So let's move on. Do vaccines cause autism? Not based on the studies that we're seeing. Studies have shown that there is no link between receiving vaccines and developing autism spectrum disorder. In 2011, an Institute of Medication report on 8 vaccines given to children and adults found that, with rare exceptions, these vaccines are very safe. Trimeracil, we briefly discussed this, is a compound that contains mercury. Mercury is a metal found naturally in the environment. It's put in the multi-vial of vaccine to prevent growth and contamination of dangerous microbes. DTaP and DTaP-Hib combination vaccines have trace amounts. Receiving a vaccine contaminated with bacteria can be deadly. We're just about there. In 1990, the law required the Food and Drug Administration to assess the amount of mercury in all products, not just vaccines. The U.S. Public Health Service decided to remove as much mercury as possible from vaccines. Trimersal was the only source of mercury in vaccines. There was no evidence that trimersal in vaccine was dangerous. It was removed as a precautionary measure to decrease overall exposure to mercury among young infants. Reformulated childhood vaccines leave out trimersal without threatening vaccine safety, effectiveness, and purity. Childhood vaccines that used to contain trimersal as a preservative are now put in the single-dose vials, so no preservative is needed. We discussed that earlier. So, was trimersal in vaccines the cause of autism? Reputable scientific studies have shown that mercury in vaccines given to young children is not a cause of autism. The studies use different methods. Some examine rates of autism in a state or country, comparing autism rates before and after trimersal was removed as a preservative from vaccines. In the United States and other countries, the number of children diagnosed with autism has not gone down since trimersal was removed from vaccines. Are vaccines safe? We would say yes. Millions of children and adults are vaccinated every year. Thousands of people take part in a clinical trial before licensed by the FDA. Any medicine can cause reactions in some people. Common side effects are swelling or tenderness at the injection site and fever. Serious reactions are rare. Happens in 1 to 2 people out of a million. And we discussed the vaccine adverse event reporting system. This helps to track adverse reactions in vaccines. So, free and low-cost immunization resources. I'm going to go through this quickly. So, let's see, LA County Immunization Program, that's our former name. We're now the Los Angeles County Vaccine Preventable Disease Control Program. We have a provider list on our website. Clinics that provide no-cost, low-cost immunizations to children 18 years of age and younger. Vaccines for Children program. We also have adults. Children 12 years of age and older may consent to receive HPV and Hep B vaccine. Parental consent is not required for all vaccines. Please call the clinics in advance to ensure the availability and the clinical hours, and always take the child's immunization record. Or you can call 211. And I'm going to go through these quickly. Most pharmaceuticals that make a vaccine, they all have what we call, it's a patient assistance program, where they will replenish the vaccine. I understand before, now this was before the Affordable Health Care Act, the patient and provider fill out a 1 or 2 page application, fax it over to the pharmaceutical company. They fax it back right away. The doctor can give the vaccine, and the pharmaceutical company will send them another vaccine to replace it. Now, before the Affordable Health Care Act, they did not verify income, but now, since we have the Affordable Care, I don't know how things are going. They may verify your income. Okay, so we're almost there. So again, I'm going to skip to these, but just about every pharmaceutical company has a patient assistance program. Look at their website. And here are some immunization resources. And I think that might be it. And again, if you wish to receive 1.5 continuing education credit for licensed personnel or certificate of participation, we ask that you complete the survey at this link by November 20th, and we'll send that information out to you 1 to 2 weeks after you complete, after November 20th. And let's see, our questions. Are there any questions? Verbal consent. Okay, what's the deal with the verbal consent? No, well,
that question was asked when you were talking about, when you asked the quiz question about whether written consent was.
Well, again, the only thing required by law is the vaccine information statement. It says no consent is required. But understandably, healthcare clinics and hospitals do have a consent in place. And, you know, when you consent for treatment that is included, may not be specific for vaccines. But by law, it's not required. So that's what we want to drive home, that vaccine information statement is required by law. And let's see, are there any more questions? No questions? Oh, let's see. When you visit the doctor's office, sometimes they ask you if you like a flu vaccine with or without egg. Is this used a preservative? Oh, there's different types of vaccines. Okay. Yeah, you know, some of the vaccines on our list may say they have egg allergy.
Egg allergy is not a contraindication to vaccination.
Yeah, the recommendations and the contraindications have changed. We have a diagram that we can use, well, for the children, but egg allergy is not a contraindication.
If you can eat eggs or egg products and you just get hives, you can have...
Melanie's going to join us.
Good morning, everybody. So if you can eat eggs or egg products and you just get hives, you can still get a flu vaccination. There's a couple that are made without eggs. It's called RIV. You can get that, but it's only for 18 years and older. If you've had you seriously can't have eggs and you've had like a reaction, almost like an anaphylactic reaction, they still say you can get the flu vaccine, but you should get it in the office where they're able to react to your symptoms. So, you know, give you epi or give you some kind of treatment if you've had a previous strong reaction to it. So yeah, egg allergy, it says, is this used as a preservative? No, the egg is not used as a preservative. Part of the cells of the eggs are actually used to make the vaccine. And I believe it might be chicken eggs.
Thank you. You're welcome, Veronica.
You're welcome.
Thank you for the question. Are there any other questions that we can address?
I can try unmuting everyone if...
Okay, that's good. Yeah, we can talk. I have heard say that Tdap vaccine is good for 10 years. That vaccine, it's good.
Tdap is currently only recommended as a one-time dose. The booster would be TD.
Yeah. Only remember that was we mentioned that only the pregnant woman should get that every pregnancy between 27 and 36 weeks. But anyone else should get, after they get the Tdap, they can get the TD 10 years later.
There's been some discussion about changing the recommendation to have a Tdap every year, but the ACIP is basically saying it's not really cost effective because the vaccine really is not that great of a vaccine, and the pertussis component really doesn't last that long. It really only lasts like 2 to 3 years, so that's why we're kind of starting to see a lot of pertussis cases in adolescents, because you know they get it at 11 to 12 years of age. So we're starting to see a lot of that, and it's mainly because it's the acellular pertussis. And that's different than the wholesale pertussis that used to be out years ago, and they took that off the market because kids were having seizures. So even now, with kids getting DTaP, which is still another acellular vaccine, we're starting to see pertussis cases because that is not lasting as long as they had hoped for. Hopefully, they're working on a improved vaccine. I'm not sure when that's going to come out. But there's also been talk of having Tdap be the booster, but that hasn't been approved by ACIP.
Okay, let's see. Keely, so we can recommend family members to get Tdap when a new baby has come home. Before the baby, do it before the baby come home, because it takes 2 weeks to develop protection.
and it's only if they haven't been vaccinated. So if the husband already received, say this is their third child and he got the Tdap vaccine when they had their first baby, he shouldn't get another one. It's only a one-time dose unless you're pregnant.
Thank you for those questions. Are there any more questions? Oh, here we go. Okay. All right. Any more questions?
Oh. I'll try unmuting it for a minute. Let's see how.
Okay.
Everyone is unmuted. If anyone would like to ask a question over the phone. Do we have any questions from anyone who would like to talk instead of type?
I have a question. Oh,
sure.
Alexis, are you there?
Nice.
Alexis? Good morning, Alexis. Are you there?
Alexis, who are you looking for?
Alexis, did I hear Alexis Rosen?
Yes.
Yes, is she there?
She is on the webinar.
Oh, she can't answer, huh? Oh, okay. Well, I was going to ask her a question. That's okay.
I can't.
Alexis.
Yeah.
Alexis, did you used to work in the foster care program?
Yes, Kim. I'm
Hi, Alexis.
TV program.
How are you?
Good. How are you? Hey, I was kind of saying, that's what saying my presentation.
Oh, well, thank you, Alexis. Thank you. I told Melanie that was you. That's Alexis.
Yeah. Hey, hi, Melanie. How are you?
Yeah, we're still here. Yay.
Yeah, you guys did a great job.
Thank you. I hope you guys find the information useful. And again, if you want a copy of the presentation with all these links that you can, check out the information yourself, we're happy to send it to you after you complete the evaluation.
Please do. Kim, would you be able to send me the slides, and then maybe after November 20th, I can send them out to the group?
Hold on a second. Hold on a second, you guys.
I'm going to mute everybody again. Okay, Kim, would it be okay after November 20th? I can send these slides out to the group. Would that be okay?
Yeah, I'll send. Well, we have to get the evaluations first and the post test. So you know what?
Right.
Click that link. Go on that link tomorrow. We usually send it out after we get your post test and evaluation.
But if the link is, or maybe she can just send this link to everybody.
Yeah, do it because I think I have to set it up. It's not set up. It'll be set up by today, the end of the day. So don't click on it today. Click on it tomorrow. Okay.
Okay. Yeah. So just send me the link, and I will make sure to send it out to the group, and then they'll be able to get the slides from you directly.
Okay. Okay. All right. So if there are no questions, I guess we'll call it a day.
Yes, with 7 minutes to spare. Thank you so much, Kim. I really appreciate you coming.
Thank you, everyone. Thank you for your attention. We really appreciate it, sharing the information.
Okay, and like I said, this webinar was recorded, so we will post it on the blog after the post test. So thank you.
Okay.
All right.
All right. Well, thank you, everyone. Have a good day.
Have a great day, and I hope everyone gets a chance to vote.
Yay! Yes, go vote, please. All right. Take care, you guys.
Take care. Bye-bye.